Hello everyone, and hello Dr. Horne. It's really a pleasure to meet you in Istanbul, and I'm starting if you want. I'm Ayşegül Bestel. I'm an obstetrician and a gynecologist in Istanbul, and I'm a young member in Endometriosis and Adenomyosiz. And if you want, we can continue with you. Could you introduce yourself?
Thank you. Really nice to meet you and great to be in Istanbul. My name's Andrew Horne. I'm from the University of Edinburgh in the UK, and I work both as a clinician and a researcher. Clinically, I run a pelvic pain and an endometriosis service in Edinburgh, so it's a very multidisciplinary approach. And then my research reflects my clinical work, and I do anything from basic laboratory-based science to better understand endometriosis through to early phase and multi-centre clinical trials.
Yes, and how is your daily routine?
It's very variable. I don't think any day is the same. I have set clinical sessions, so I do a clinic on certain days, and that's often a clinic with other clinicians like anaesthetists and psychologists, colorectal surgeons, urologists. I operate as well, and that's often with other gynecologists. And then my routine in terms of my academic research work, very, very variable. A lot of meetings, I suppose, a lot of planning, discussions, overseeing the laboratory and the trial work. Quite a bit of travel to conferences and meetings and giving lectures and like this one. So very, very variable. I also do quite a lot of public engagement. So I will speak to patients, give talks to patients, think of novel ways of talking about science with the public as well. So I enjoy that side of things. Do some activity, you know, in the press and the media as well.
Really busy program, I think.
Yeah.
And you have been working with endometriosis and pelvic pain for a long time. And can you tell us how your journey started?
So interestingly, I did, during my training, I did a PhD quite early on the biology of the endometrium, but it wasn't focused on endometriosis. It was more in relation to infertility and implantation failure. And then I went back and finished off my general obstetrics and gynecology training, and during that time I took time out to be a lecturer, so I was part-time research, and I studied the biology of ectopic pregnancy, so still not endometriosis. And then it wasn't until about 12 years ago, when I finished my training, I decided to set up the endometriosis and the pelvic pain services clinically, and then my research kind of mirrored what I was doing in the clinical setting. So that's how I entered that. I got to the point in my training and I thought, we're really not managing these patients very well. We're not giving them a good service. And so that sort of stimulated me to develop our service better. And then things have kind of come from that point onwards.
And how did you become interested in women's health and endometriosis?
I think largely to do with thinking that we were not managing the patients well. Interestingly, the group of patients I thought that we managed the worst were the patients who had pelvic pain and no endometriosis. And I felt we just rejected those patients, and I wanted to think of better ways of supporting them, looking at better treatments for those patients. And then, of course, I then looked at how we manage a lot of the endometriosis patients, and I'm particularly interested, as you know, in superficial peritoneal disease, because I think we are not managing that group of patients optimally. As you know, lots of them have repeated surgeries, and then if they try medical management, around 2/3 of them will find they have side effects or it doesn't help their treatment. So I'm really keen moving forward to be able to at least be able to predict in those patients which of our available treatments they might respond best to, but also develop new treatments for them so that we can make their lives better, essentially.
And what is the important part of the evaluation and examination of a patient with endometriosis or pelvic pain?
I think the most important part is to show as a clinician that you listen and you care. So it's very easy to rush patients, to give the impression that you're not taking their symptoms seriously. So that's really important to start with. It's making them feel that they're in control of their own journey. So, asking them why they're here, what they're wanting to get out of the appointment is really helpful. Because for some patients, they maybe want a diagnosis, and then you need to explore with them, the best approach. Some patients maybe don't want a diagnosis, but want medical management. And then there are other patients, of course, as who've read a lot, have been on social media, and are very sure that they want surgery to manage their symptoms. So it's all about kind of listening and exploring the patient's expectations at these first visits, I think.
And what do you think the hardest thing about women's health and about endometriosis?
I think the hardest thing, and this accounts both from being a clinician and being a researcher, is the lack of investment historically in women's health, and in particular endometriosis. So on the clinical side, we still don't have the infrastructure for managing these patients appropriately. We need more specialist nurses, we need more sort of accessory medical services, pain management support for patients with endometriosis. And then in terms of research, we're way behind other conditions like Crohn's disease, diabetes, which have had a lot more money invested in them, which we understand better and are able to manage much better.
Mm-hmm. And what do you suggest to us regarding pain management in endometriosis patients?
So I suppose, again, it goes back to that exploring with the patient what they've tried first. There's nothing worse than seeing a patient and offering them paracetamol or non-steroidals when they've gone through all the different treatment options available to them. So taking a really good history about what's worked for them, what hasn't worked for them in the past. And then it's about exploring with them whether or not they want a sort of combined hormone and neuromodulatory approach, which I think is often helpful because we know that patients have often a mix of different types of pain. And then it's also about saying to them that that's medical management, so there's management with drugs, seeing if they want support from the point of view of a psychologist, so mindfulness, CBT. It's difficult living with chronic pain. I think there's also a real place for a physiotherapist because we know that patients with endometriosis often have tension within their pelvic floor, and relaxation exercises and physio input can be helpful. And then I think a dietitian is really helpful. We don't have a special diet for endometriosis that's evidence-based, but then we do know that lots of patients can remove things or add things to their diet, and that can be helpful. So doing that in a controlled way with a dietitian, I think, is really important.
I think we have to think everything about patients.
Absolutely, yeah.
And what advice would you give to us young researchers and physicians who want to specialize in endometriosis?
So I think, first of all, I'd say I love my job, so I'd be very positive and say that I'm sure you'll enjoy it and get satisfaction out of it. I think there's so many unanswered questions. You can go down any number of different research routes if that's what you're interested in. I think it's really important as a clinician and a researcher to try not to be narrow-minded and focus only on surgery, for example, but to think broadly in terms of medical management, not just hormones, but how we can manage all of the symptoms that patients with endometriosis present. So in the clinical side, that might be working with a gastroenterologist, a urologist, psychologist, etc. And then from a research perspective, bringing in ideas from cancer researchers, gastroenterology researchers, that sort of thing. So being very broad in your approach to both research and clinical work.
Yeah. Thank you very much for your time and valuable contributions. Thank you.
Pleasure. Thank you for having me in Istanbul.
Yeah. Nice meeting you.
You too. Thanks.